Hello, Dr. Gershon. Thank you for joining us today.
Hi, thank you for having me.
So you're here with the Demystifying Medicine channel, in which we take complex medical topics and we break them down into their simpler components. Today, we're going to be talking about prenatal medicine. So do you want to just give us a bit of a background on your medical history?
Yeah, so I'm a resident in medical genetics at the University of Toronto. I did my medical school training at the University of Western Ontario. Before that, I did biochemistry and pathobiology at the University of Toronto. And like I said, yeah, I'm currently a resident at the University of Toronto, mostly based out of sick kids in medical genetics and genomics.
Okay, perfect. So yeah, so you seem like a great person to talk to about prenatal medicine. And so it's really a complicated topic that a lot of people have a lot of questions through all age groups, really. So that really made us interested in breaking this topic down into a way that all people from all different education levels could get their share in and ask their questions. So actually, in this, we have a few different individuals who we ask questions to. We have an individual from grade 3, high school, middle school, as well as university and an expert. And they all shared questions that they had about prenatal genetics or just genetics as a whole. So the questions are going to get increasingly more complex, but I hope to ask about 2 questions per individual. So from the person in grade 3, the first question they said was, what is genetics?
Yeah, so genetics is the study of the material that every living thing has that is inherited from your mom and dad. So everybody's made up of many cells, millions of cells, and then inside the cells are nuclei, and those are full of genetic information, and so that's called your genes. And your genes are responsible for all the traits that you have, like the color of your hair, the color of your eyes, but also how your body grows and develops. So the shape of your face, how tall you are, many of these things are uh, determined by your genes. So that's what genetics is, the study of all that stuff.
Hmm. I see. And when I was explaining genetic testing to this individual and what it is, they had a question, which was that does every person get genetic testing done? Um, did their mom get genetic testing done too? Is one of the questions they had. Um, and if they get genetic testing done, do they know what the baby is going to look like when they're born?
Yeah. So what I explained before was genetics. I'll tell you that can be like a scientist can study genetics. A medical geneticist is someone who tries to use genetics to answer questions that are medical. And so you asked me, does everybody get genetics? And so it kind of depends on the situation, but everybody who's pregnant can potentially be offered genetic testing to learn more about the baby. And you asked me, will we know what the baby will look like? In most cases, we don't, but in some specific situations, maybe you'll find a disease that has a particular look to it. Like patients will look a certain way with that disease, with that genetic change. So you might be able to predict that they have some medical issues, and maybe that they also have a certain look. So those are the things you could see with genetics.
Okay, great. Thanks for answering those. And now moving up the ladder, we have a question from a middle schooler who's learned about genetic testing and was wondering what the risks are involved in it.
The risks involved in genetic testing.
Correct. Yes.
Yeah, so um, there's a risk involved with how you take the genetic sample. To do a genetic test, we need to have a sample from somebody. And so usually that's blood. And so that involves taking a needle and getting blood out of somebody, which can be a little bit of pain and discomfort. Um, but if you want to test the DNA of a baby, sometimes that's still within the pregnancy. You sometimes will have to sample those cells directly. So you'll have to put a needle into the mom's belly and then around the amniotic cavity and withdraw some cells that are floating around in there. And so there's some small risk of infection anytime you do anything in medicine, but when it comes to pregnancy, you can cause chorioamnionitis, which is a kind of infection that you can have in pregnancy, and it can also cause sometimes, rarely, preterm labor. So there are some risks, even though they're quite small, to doing genetic testing. And that genetic procedure I was talking about, where you put the needle into the amniotic cavity, is called an amniocentesis.
Okay, gotcha. Yeah, so it seems like there's some different types of prenatal testing that are involved. The other question is there a reason sometimes why they might test these different types of prenatal testing? Is there a reason why they might choose one over the other?
Yeah, so there's three kinds of genetic testing. And actually, before we get to genetic testing, let's talk about the step before. So in Ontario, where I'm practicing, there are multiple, and everywhere around the world has their own version of this. But that's a screening program where pregnancy, especially at high risk, might get screening to screen for common problems, which may be very difficult to treat. And so things like trisomy 21 or trisomy 18 or 13, these are things where the baby receives a whole extra copy of a chromosome. And in some cases, it can lead to really serious health outcomes, like multiple heart defects, those sorts of things. And so there's our programs to detect which pregnancies will be the highest at risk of that. And so sometimes I'll do a blood test and see certain levels in the blood are different, or they'll do a special kind of ultrasound to look at the back of the neck to make sure that that structure is growing well. And then if there's anything different about that, then that might increase the risk that you'll find something genetic. So that's all the pre-genetic kind of testing. Those are all clinical tests. And then when it comes to genetic testing, there's three in prenatal world. So one is called a non-invasive prenatal test, an IPT. And so that's a blood test where you're looking at the blood of the mom and you're trying to find fragments of the baby's blood, baby's DNA fragments. And then you're able to do some statistical analysis to see if there's too much of one of baby's chromosomes. So you can learn about the baby from the mom's blood. And then the other two tests sample directly the fetal tissue. And so CVS is one called chorionic villus sampling, and the other one is called amniocentesis, which we already spoke about, where you're directly sampling cells from the fetus.
Gotcha. Thanks for answering those. Yeah, that really helped. Now we're moving up a little bit and we're going to the high school student, and the questions get a little bit more specific. And one of the questions they were wondering was, how exactly does ultrasound testing work? I understand that an ultrasound means imaging of a fetus or of a baby within inside someone, but how does it work in the sense that what are they looking for on that screen?
Yeah, so an ultrasound can be done at different times in the pregnancy to look at different things. Very early in the pregnancy, you might just want to know if there is a pregnancy, or how big it is and how long the pregnancy is. That can help you determine the date. Later on, you can do something called an anatomy scan, where you can just go head to toe and just look at all the major organs that you can on the ultrasound. Sometimes you get a limited view and sometimes you can't really see everything, but you can get a sense of, are there 5 fingers on both hands? Are there hands and feet? Is there an abnormal configuration of the hands and feet, like any defects that way? Is the heart look okay? Or there can be heart defects that are detected this way. There can be brain defects or other things, like what I mentioned, the back of the neck, as we develop, has a certain thickness, but in some genetic conditions, it's much, much thicker. And so that can be a hint for us to try to find out what else is going on. You also can look at the brain and see if there's like a brain abnormality. Sometimes you'll be able to pick that up. And so you're really looking generally at the gross anatomy, is what we would call it. And then it's up to the doctors to put together if that means anything and what that might mean. Is that a genetic thing? Is it something completely different? And so that's what you can see with ultrasound.
Okay, thank you. And moving on, we have a university student who was me for this case. I was curious about 2 questions in particular. first and foremost, are there any ethical concerns surrounding prenatal testing?
Yeah, there's a few ethical situations. So first has to do with uncertainty, and we're often, especially with the screening test NIPT, that's not really always accurate. And so we always have to balance what the test is saying with what we think could be going on. So for example, the NIPT, it actually now just shows you the risk instead of showing you positive or negative on its own. For example, let's say you had a young, healthy woman in early pregnancy, and she has a positive NIPT screen for trisomy 18. Even though that screen is positive, it might be not. It might just be a problem with the way they ran the test, or just it happened to be that that's how many fragments they found in the DNA in the mom's blood, and so there's a chance, and sometimes it's a pretty big chance that that test is wrong. And so our job is to then offer the next test, which is to really get to the bottom of it by doing a more invasive kind of procedure. But the ethics of it is sometimes people can be stuck with uncertainty, and maybe they're not comfortable with the next test, and so they end up being stuck in this area where they don't really know until the baby's born, and then a doctor is able to assess the baby then. The other ethical situations that come up is that sometimes in genetic testing, you're testing one individual, and in this case, maybe it's just the fetus and the mom, but you actually are indirectly saying something about the patient's family and their parents, and maybe their parents, and maybe other people in the family may also find the information interesting, or maybe they don't want to know. And so there's a lot in genetics of sometimes people really don't want to know all the information, and sometimes they want to know all the information, and then maybe we don't know what to do with it. And so there's lots of you have to be very thoughtful about what kind of tests you order, and then what kind of results you're going to get.
Okay, interesting. And just out of curiosity, just building off of that, is there any times where the medical community will do these tests privately? They'll take in the results and they'll understand it themselves, but then they'll only share it upon request. Like, does that happen where like they'll look at the results prior to consent, or is it only upon consent do they look at the results?
Yeah, the consent happens before the blood is drawn, before the test is sent in most of the situations. And then that's the point where we talk about what you would want to do with the results. It gets very, very complicated the other way, because then you kind of know, and then it's also in the patient chart, which the patient could just access by themselves. So it's a complicated thing. If it's something you don't want to know, you should talk to someone before you send the test, and then maybe there's ways of doing that. There are ways to hide certain pieces of information in the DNA report that is optional. So for example, we sometimes will run a whole genome test where you look at all the genes that we know. So that's over 20,000 genes. And then sometimes those genes have implications to like future disease that a patient could have, but there may not be anything to do with it. So the patient can opt in or opt out of those findings. And so that might be like they do a test for some other reason, like they have some kind of blood problem, and then you're telling them later they could have Huntington disease when they're 60 and there's no treatment for it. And sometimes people would find that very troubling. And there have even been stories in cases of people being like depressed because of the answer that they got off of genetics and like ending their life because of it. So you want to be very careful about what kind of information you want, or what kind of information the patient wants to know. So it's all guided by the patient in this process here.
I see. Yeah, thank you for answering that. So we're going to move on to the next level. We have a question from an expert, and it's a scenario-based question that they indicated to me from Leslie Solomon at Mackenzie Health. And the question goes as such: a couple is pregnant, and you do carrier testing on the parents. Both are carriers of a BRCA2 mutation, which indicates a 1 in 4 chance that the baby could have Fanconi anemia. it also means that the dad and especially the mom carry a gene for hereditary breast cancer and ovarian cancer and are themselves, especially the mom, at high risk for cancer. How do you deal with these issues?
Yeah, so there's a bunch of issues happening all at the same time, right? So the baby is at risk of Fanconi anemia and probably has it actually if they have both copies. And so the baby can have many different health problems. They might have abnormal thumbs. They might have a defect or a problem with their bone marrow. So they get early bone marrow failure and they get anemia that way. So that means they're not making enough red blood cells, and um, actually all of their cell lines can go down. They're also at risk of getting certain kinds of cancer themselves. Um, but that's the child, and so there's implications of this diagnosis on the child. You might want to treat them very differently and get them seen by an oncologist, even possibly. And then the parents are going to be at risk for different kinds of cancers. They'll be at risk for breast cancer or uh, um, even like male breast cancer, something that's rare but can happen in patients with this mutation. And so you want to talk to the whole family and see how they're feeling about all that, making sure they have all the connections to all of the treatments that they're going to need. For example, in Ontario, we have a breast cancer screening program where people above a certain age will get screening. But if you have high risk things, and this is one of them, you can, instead of getting mammograms, which are x-rays, you might be followed with mammograms plus MRIs of the breast before you even have any tumor to get, like, try to catch it early. And so there's lots of different issues happening in this family.
Wow. Thanks. Yeah, it's really cool to just see the progression of how like in depth this topic is, just going from the grade 3 and up, and just seeing how many levels you can take this from. So thank you for talking with us today. Thank you to explaining this to all the people who watch, no matter what education level they are. And best of luck in your future practices, Dr. Gershon.
Awesome. Thank you so much for having me. It was great to chat today.
All right, take
Bye.
care. Bye.